Hello everyone, this is Dr. Zilin Wang. Today is January 8, 2025. I wish everybody have a happy new year. Today I want to talk about a heated topic that issued discussion on health insurance in LinkedIn. The all started with a person by Kevin McCaffrey on the doctors on socialmedia.com. He stated health insurance is cool because you get to pay a bunch of money each month for nothing. And then if something happens to you, you pay a bunch more. Then Donna Coriel, MD, who is a founder and CEO of Doctors, uh, respond to that. She said, repeat after me. Health insurance should be for catastrophic coverage and nothing more. When we get coverage for our cars, it doesn't cover maintenance or the oil changes. It covers major accidents. Health insurance should work the same exact way. ETA, these are discussions I am hoping attendees and speakers will openly have at our upcoming healthcare focused conference, the conference called Dissecting Healthcare, a State of Medicine Conference, date indeterminate. After this, the discussion is ongoing. I cannot give you all the details for the discussion, but I enjoy and also post my own opinions. What I have said, once again, you are treating the symptoms, not disease itself. U.S. healthcare system has been driven by profit, not patient care. That was determined by business people, not physicians. The root of cause is business mindset, which has controlled the whole healthcare system. Let me remind you how the healthcare insurance started. I use a story to illustrate. Mr. Smith had acute appendicitis. He obviously needed surgery. He couldn't afford it and he asked for help. The mayor held a town hall meeting, asked the community to help. Everybody chipped in. Mr. Smith got surgery and he was cured. The mayor thought, what if someone else had major medical issues in his community that they cannot afford? He cannot keep asking all the community members to chip in all the time. Therefore, he held another town hall meeting and asked to set up an emergency fund. It was how health insurance started. It was initially managed by town officials who were paid by their salary. I called him middleman. Here's the kicker. When the fund got away very big, the middleman start getting greedy and he wants to be paid more. Thereafter, he wants not only paid more, but also want to control who and how much he will pay through the fund because he wants to leave more margin of profit for himself. You see, we have to get rid of greedy middlemen, strip away their capacity for controlling the fund. Then the discussion was coming out how we can reform health insurance. Well, people tried different ways. For example, I know for sure you all know about the self-insurers. Those are companies fed up with insurance company double-digit increase premiums every single year, which become unable to afford to support their employees. Therefore, they funded the pool of money to set up a self-insurer uh, insurance. The initial idea is great because they want to save the money by control the health insurance spending. One problem come up. They don't know how to manage the money fund, the pool, and how to pay to the healthcare providers like hospital, clinic, and doctors. Therefore, they turn back to the evil that they exactly want to avoid, which is healthcare and insurance companies. They've called third-party administrator. The third-party administrator know how to set up the fee schedule, knows how to use the CPT code and to address the management or dispense the fund to care the employees' health care. I was honored to invite to give a speech in 17th healthcare benefit conference in Orlando, and also I was giving speech in 13th Mississippi Self-Insurance, Mississippi Association of Self-Insured in spring. Basically, I delivered the same concept. I said, cash is king. You have a leverage of cash to pay the providers that are taking care of your employees. But you turn back to the evils that you're exactly trying to avoid and let them manage your self-insured fund, and you actually lost the leverage you have already. So I don't know, have you heard about shockless philosophy? Albert Einstein, when he was young, he has one of the small problems. He has a very big toe, and very often he finds himself where the socks, the toe come out, make a hole. So he was very annoyed. Most people will do either sew up the hole and continue wear the socks, or buy new socks. But he didn't do that. What he did? He stopped wearing socks. So that's the way he managed the problem that daily bothering him and make him life getting a little bit more difficult. So this philosophy should also apply to the healthcare insurance industry. We were patient care centered health insurance in the past. If you see the story, the emergency fund Mayer established is not meant to have the middleman to make a profit initially. He wants the money to goes to the patient care. That's initially objectives. But today's world, the health insurance actually become the money profiting machine. The money does not mean to spend on patient care, but it means for the profit purpose. In past decades, the healthcare insurance payment has not increased dramatically, stayed relatively speaking flat, but the administration cost has increased by 93%. 93%. What the administration cost is board of trustees or board of directors salary, CEO salaries, and all the salespeople's salaries, and buildings, office, real estate, and investment. Those are the administration cost. It has nothing to do with patient care. The United Health Insurance CEO was assassinated on the street of New York City. This is a tragedy. Nobody deserves to be assassinated. But it also triggered a lot of reaction on the social media. Unfortunately, majority people on the social media doesn't show any sympathy to the CEO. They all see him as an evil person. They have a reason to believe that because everybody have a story that they paid the insurance company, and the insurance company try very best to keep the money for themselves. In recent phenomenon, it called HMO, private health medical Medicare. Medicare money is supposed to be strictly for beneficiaries of Medicare patients, not for private insurance company. However, those HMO making near $2,000 per person per year. The money literally gave to the insurance company, quote unquote, managing. So how they keep the money? Let's see, Medicare gave each patient benefit to the private insurance company to manage those patients. This is exactly what the HMO called. But instead, they spend money on the patient care. They try everything, including what I call the 3D. Deny, delay, and discount. I often receive the facts from management company ask me to give discount for the care I give. And they, in turn, they said, we will pay you quickly. That means if I don't agree, they will postpone the payment. As you all know, private practice requires significant cash flow to be afloat. But they are using those as a weapon to sabotage us by delay the payment. So what's the solution? Let me ask you the very simple question. We were in the patient care, patient-centered business model of healthcare and insurance. Why we cannot go back? How do we go back? First of all, number one, if you still want current insurance company exist, the regulation has to be done to minimize their profit margin. Or not, I don't want to call the profit margin, I want to call the maintenance of healthcare fund. Then let me ask you another question. If you have an investment account managed by the financial institute, if they take a huge amount of your own fund as their profit and give very little back to you, would you let them continue? Of course not. So I have did a calculation. If you, for example, I have paid 3 of my family member through the Blue Cross Blue Shield for about $1,800 a month. $1,800 a month, if you do compounding, you pretty quickly you can reach to $1 million very fast if you invest, let's see, just by 5% annual return. So this money has been held for them. I have not spent a significant amount of money on I have no office visit, I have nothing to spend on my health care because I'm trying to maintain my health. And there is this just keep my money. So let me ask you this: if that's all right, if the money in the future I have disease and spend on me, that's fine. But no, this is what they keep for their profit. So what I will say, regulation-wise, you have to have a limitation how much allowed to spend on the fund management. For example, you can say 5%, 8%, that should be it. You cannot spend more than that. And then, in other words, 98% of the money should be spent on patient care. Number 2, there's another problem we call PA, pre-authorization. Pre-authorization is really considered to be illegal. The reason it's illegal is the physician, or they call the medical director, in the insurance company, which he was paid or she was paid by the insurance company, their solely purpose is how to increase the margin of deny. That's all it is. They want to deny the care. But they know for layman who has no medical license, you cannot deny patient care for medical necessity person. The person who determines medical necessity has to be licensed practicing physician. Then the question come out. I'm in the state of Mississippi. Does the medical director has medical license in my state of Mississippi? If not, you are illegal to practice in Mississippi because you read my notes, and based on just by notes, I never get called for a medical director tell me, okay, why you want to do this, how you want to do this. No, they never see the patient. They never examine the patient. I'm the only one examine the patient, see the patient, make a medical decision, and get a medical plan for the treatment. The other side is a medical, quote-unquote, medical director. I don't know even he has a Mississippi state license. He override my decision, said, we are not going to cover it because we don't think it's a medical necessity. How did he make such a decision by himself? And without seeing patient, how did he knows that this patient, individual, just by reading my notes and make a decision like that? And what's the rationale? They never tell you. They can say you can appeal, but most often the appeal take a very long time, which is we spend a lot of time. This is their strategy. They want you to spend a lot of time, so much time that you have no time to take care of patient anymore. So physicians end up giving up. That's their strategy. They want you get so tired, they don't want to push. You don't want to pursue it anymore, because so that's the problem when you come to patient care. The patient is not being cared, so physicians spend a lot of time with an insurance company, in terms of paperwork they demand. And they also have another trick we just find out, but after the United Health insurance company, the trick, they set up a fax by only 10 pages. But when your medical record exceed 10 pages, they will tell you they never receive your medical record. So this is their trick. So everything they trying to do, delay, deny, delay, and discount. So my proposal on this portion is make pre-authorization illegal, because you cannot decide without seeing patients that this is a treatment is inappropriate. So how, to be fair, I recommend to set up arbitrary system. The arbitrary system is not in patient side and not receive money from patient side, not receive my money from insurance side. It's become independent. So therefore, they are not going to be influenced by patient side or insurance side. So they, in other words, they are neutral. So the insurance company, if they feel the medical treatment need to be denied, they need to send it to arbitrary board. The arbitrary board will be organized by local physician, and at least 10 of them. They review the medical record and even interview the patient if it's necessary, in the specialty the patient's doctor need, not your primary care doctor and trying to judge cardiology practice or surgery practice. That's not appropriate. So the medical arbitrary board make a decision, either their reasoning is merit or not. And then they determine this insurance is rightful to deny the service. However, if not, they will deny them. And another thing is, if insurance spend too much time on the send a lot of bogus denies to the arbitrary board, the arbitrary board should have authority to give them a fine and even deny the access to arbitrary board, make sure they will be paid. So those are steps need to be taken to make an insurance company become truly medical insurance, not driven by profit. Because the money or the fund in the health insurance we pay the monthly as a premium, supposed to take care of our patient, not their profit. And the third thing, healthcare insurance should not be New York Stock Exchange. They are not profit-driven insurance. They should be non-profit organization. And now let's talk about self-insurer. Self-insurer, if you're listening, you make wrong decision by hire the third-party administrator to take care of your employee patient. Now you can see the patient's healthcare cost has not decreased much because your third-party administration want to control your self-insured. So the best way for you, use the cash as a leverage, directly communicate with providers. I know this is big, but this can set up easily. And another thing is eliminate CPT code. AMA, American Medical Association, few decades ago set up this CPT code only to answer one simple question. The simple question is, what did you do to my patient? That's the only question they ask. But you guess what? This simple question is become milk call to AMA. They profit $80 million a year. Who paid this $80 million a year? We do, as a beneficiary. We pay those $80 million a year to give to them simply to answer one question. What did you do to my patient? So you will get paid. So this question should not be cost so much money for us. So CPT code shall be eliminated. We have AI technology now. AI technology can be easily solve this problem without spend so much money. So that's my answer to another CPT code. This is big money laundering, and they are not supposed to be there. And also, law should be reinforced if they keep denying us for rightful healthcare access. United States is the most expensive and not very good life expectancy. So we can cut the cost. Now we have Dodge. I hope they will listen to us, make sure healthcare insurance is not profit driven. It should be patient care. This is come from me, a front runner, private practicing cardiologist. So I see this every day. I know what it is, and I know how we can solve this problem. I hope they will listen and hear what I said. And hopefully you will like this post. You will spread it by like, share, subscribe my YouTube channel. I hope my YouTube channel on this podcast will not be censored. Thank you very much. You have a wonderful day.